Well, let's move on to another of today's top stories, and that's what we've just been discussing, COVID. The numbers are shooting up. Gauteng continues to report the highest number of cases. At least 9,443 new infections have been confirmed in the province overnight, which equates to nearly 57% of the total number of people infected in the country. For an update on the situation in the province, let's speak to Dr. Samantha Fee, who's a representative of the Gauteng General Practitioners Collaboration. Doctor, thank you so much for joining us. We're hearing of an almost apocalyptic feeling at some of Gauteng's hospitals. You're on the ground. What is going on?
Good morning, and thanks for having me. Apocalyptic, I think, is a good way of describing it. I think brutal is another word I've heard used, bandied around. We are truly overwhelmed. The numbers that you quote are devastating to the country, but to the healthcare workers, I think everyone's looking forward and wondering how they're going to survive the next couple of weeks.
Talk to me about what the situation looks like, just from anecdotal evidence from your colleagues and in your practice, in terms of patients being treated, the situation in hospitals. If I were to walk in there, what would it look like? Just say at Barra.
Well, I very fortunately am in a general practice in the suburbs, but we do have a WhatsApp group with a lot of public healthcare practitioners and doctors communicating with us. And I think they are also truly overwhelmed. We had one colleague over the weekend just explaining how they'd recently moved into one of the provincial hospitals and could not believe the number of COVID cases they were seeing. Everyone is COVID. I think a lot of staff are infected with COVID. He did say that people were doing their very, very best, that the PPE supplies at that time were good. But to put it in perspective, the numbers that are being bandied around on the news, of those people who test positive now, there's a good chance that 20% of them will become extremely unwell in the next 5 to 10 days. And that's a day on number. So with regard to our vaccination program, which now I see is going to be ramped up this week, we've still got a huge mountain to climb with the backlog from probably the last 2 weeks of positive cases who are going to arrive in our rooms and in the emergency rooms over the course of the next month. Also to understand that a vaccination, if it's given today, it's going to take up to 6 weeks for that individual to have 100% cover. So as much as we're going to start ramping up our mobile vaccination program and our 50s plus, hopefully mop up the 60s plus, one vaccination doesn't give us cover, and it's going to be a 21 to 45 day gap between the first and the second vaccination, and then another 14 days before that individual is safe. And to quote one of our colleagues, we're not going to be safe until we're all safe.
Well, those Gauteng numbers skyrocketing. Thank you for joining us. That was Dr. Samantha Fee from the Gauteng General Practitioners Collaboration, who